I'm going to give you the instructions for this test. I'll introduce each part of the test and give you time to read the question. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll hear each extract once only. Remember, while you're listening, write your answers on the question paper. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now turn over and look at the notes for extract 1. You will hear part of a consultation between a GP and a patient called Mrs. Brownstone. For questions 1 to 12, complete the notes with a word or short phrase. Hi, Mrs. Brownstone. How can I help you today?
Hi there, Dr. Rivers. I'd just like you to do a test on my waters. I've had a few problems recently. I have to go quite a lot more, and it's started to burn a little and just been a little bit uncomfortable.
I see. How long have you had these symptoms for?
Well, it's been sort of goes on and off for about 3 weeks, closer to a month, really. Some days it's better than others. I don't take too much notice. I put a lot of it down to age, but I don't think there's anything really serious, but just wondered. It seems a bit strong at the moment.
And have you had this sort of problem before a lot or not?
Oh, yes, it's happened quite often over the time. Normally just antibiotics clear it up. I'd say I've been treated for this, at least 5 times in the last 10 years.
And you've left it for a few weeks before coming in to see me. Do you sometimes get symptoms that come and go like this?
Yes, they do. And I just try to drink more, which I'm very bad at, drinking water and such like, but I try. And it usually goes. Well, it usually just goes off by itself, really.
Okay, and what about nighttime? How are you at night?
Oh, I'm up and down a lot. 3 times out in the night at least, every night. And it's more painful at nighttime, funnily enough. And it's much more urgent. At night there seems to be a lot of pressure. I think it's been going on for such a long time it's becoming normal.
Right, okay, well, that's not something we want you to be getting used to. Let's see what we can do. When you've had these symptoms in the past, you've had the antibiotics, did it calm it down?
Yes, antibiotics seem to do the trick.
And what about accidents? Any accidents with the waterworks?
No, I just have to make sure I get there quickly. I do find when I've been sitting for a while, once I get up, I've got to go immediately. So I always want to know where the loo is wherever I am.
But if you cough, sneeze, or laugh?
No, nothing like that.
Yeah. So what I'm keen to do actually is just to give you a short course of antibiotics and see how you get on. If you've had the similar things in the past and antibiotics have helped, I think that the first step is to see what happens if we do the same thing.
Right. I'm not sure if this is important or not, but I had a series of water problems way back, 25 years ago or so. I had a colposuspension in 1980 something. I was 50. And that worked. It worked well, I think.
Good. Okay, let's keep that in mind, but we will start with some treatment. But if it's not improving, we'll need to reassess the bladder function a bit more closely.
Right, okay.
Are you allergic to any medications as far as you know?
Yes, there's a few. Septrin, amoxil, and what's the other one? If you can just hold 2 seconds, I'll tell you. Keep it written down so that I can. So Septrin, amoxil, and trimethoprim.
Trimethoprim. Glad I knew that, because that would have been my first choice. You've had something called nitrofurantoin?
Yes, I've been okay with that one. The nitrofurantoin, I've had it before for 5 days.
Right, thank you. So, as you asked for, I will get you to provide us with a sample we can send to the lab. I think that what I want you to do is drop back in and see us in 5 days, and we can review the results and discuss how the medicine is working, okay? You will hear part of a consultation between a doctor and a patient called Mrs. Chambers. For questions 1 to 12, complete the notes with a word or short phrase.
Hello, Mrs. Chambers. I'm Dr. Bakari, one of the obstetricians working here at the hospital. I've just come to ask you a few questions. What is the reason you came into hospital today?
Oh, well, I started bleeding.
Oh, I see. When did you start bleeding?
I had a bleed on last Sunday.
Okay, and how many weeks pregnant are you at the moment?
I'm 36 today, and I started bleeding about a week ago.
And did you have any bleeding before that?
Actually, yeah, I did in February.
Okay, in February, how much bleeding did you have? Was it quite a bit or just spotting?
About half a cup full, and I was 28 weeks then. But the bleeding only lasted for not long, a couple of hours, then it stopped.
Okay, and when it started last Sunday, how long did it last then?
It lasted for about 3 hours, but then I'm spotting and having some old blood coming out now. Yeah, and it was quite a bit of blood. I would say about a cupful.
A cup, okay. And with this episode, did you have any pain anywhere at all?
I just get a tightness in my tummy and I get cramps. And a quite severe pain in the lower abdomen here for a bit, but it comes and goes. It started when the bleeding, at the same time as I was bleeding.
Okay. And did you have pain at 28 weeks when you had the bleeding then as well?
Yeah, it's just like period pains, cramping.
Okay, all right. Any other symptoms at all?
No, not really.
Okay. And with this pregnancy, other than the bleeding, have you had any other problems?
No.
Okay. And have you had a scan since this bleeding started?
Yes, I had one when I was 34 weeks, and they found the placenta was low, but I haven't had another one since.
Okay, and when is your next scan due?
I haven't got another one now.
Okay. All right. And when you had your booking scan at 12 weeks, everything was normal then?
Well, in my first scan, they struggled at 12 weeks to find it, so that was sort of like an internal scan, but they just said it was because it was a small baby or something. But other than that, everything was normal, I think. My visit at the antenatal clinic, everything was normal. I remember my Downs risk was low.
Okay, so everything was fine. That's good to hear. All right. Have you had any previous pregnancies?
Yeah, I've got 2 little boys. They're 2 now. Both very healthy, just a bit naughty.
All right. They twins?
Oh, yes, sorry, they're twins.
And was it a normal delivery or was it by cesarean section?
No, normal.
Normal delivery, no instruments used, nothing like that? And you didn't have to go into the intensive care unit or neonatal unit, nothing like that?
No.
Okay, all right. I think I'm starting to get a good picture. Tell me, have you ever had any uterine surgery or procedures?
Oh, yes, about 4 years ago, I had to have an abdominal myomectomy.
Oh, I see. That's good to know. What symptoms did you have with that?
It was almost exactly 2 years before my boys were born. I was really suffering, migraines, body aches, and even a fever with my period. One time the pain got so bad I had to go in for an MRI, and they found some pretty big fibroids, and at the time we were struggling to get pregnant, so the doctor suggested I have the fibroids removed. I was really nervous and considered not getting it done, but it seemed to work really well. And 2 years later, we had our boys. I never really felt any ill effects from the procedure, apart from just taking time to heal.